Hi, how are you doing this morning?
Good.
Fantastic. Well, thank you very, very much for taking the time to meet with me today. I know that your schedule as a medical student is probably very busy, very packed with things, so I don't want to take up any more of your time than is absolutely necessary. As a result, I've prepared a short script just to give you all of the relevant background information before we get started. So I think we can dive into that. It says, Hi, my name is Andrew Fogas, and I'm a user experience researcher. Today, I'll be guiding you through a usability session for a mobile app designed to help medical students practice clinical decision making. Once again, I'd like to start off by thanking you for taking the time to meet with me today. During this session, I'll ask you to share your mobile device screen and complete a few short tasks using the app. As you work through the tasks, I'd like you to think aloud as much as possible, basically articulating your thoughts as you go along, describing what you're looking at, what you're trying to do, and any thoughts or reactions you have. This really helps me understand how the app works from your perspective. Very importantly, please remember that there are no wrong answers here today. The session is about evaluating the app, not testing you or your medical knowledge. Therefore, honest feedback is what's most useful. Don't worry about giving the right answer. If you have any questions as we go along, feel free to ask. I may not be able to answer them immediately, since part of this exercise is seeing how people navigate the app without guidance, but I'll do my best to answer any remaining questions after the session. With your permission, I'd like to record this session. The recording will only be used to help me improve the app, and it will not be shared with anyone outside of the hiring process team. Recording also allows me to focus on observing instead of taking detailed notes. Do I have your permission to record?
Yeah, that's fine.
Thank you very much. I really appreciate that. And I think, did it give you a notification that recording has started? I think it did for me.
hmm
Okay, perfect. So with all that being said, do you have any questions before we dive into things?
No, I don't think so.
Perfect. I have just a couple quick preliminary questions before we dive into the scenarios today. Can you tell me a little bit about yourself and your medical education, including any experience with clinical diagnosis?
Yeah, so I'm in my third year of medical school. So we like for our first couple years, we do like classroom learning, tests and lectures and things like that. And then for the past year, we've been in the clinics and we go and like see patients and we'll kind of like get the history and do like a little physical exam and stuff. And then we go out and talk to our attending, kind of tell them what we think is going on. And then we go back in with the attending and they kind of just do everything over again. But yeah, it's a good way of testing what we are doing and what we're learning, I guess. So, yeah.
That makes a lot of sense. I really appreciate some of that background information, and I look forward to getting your insights today. Can you describe the methods or tools you currently use to learn or practice clinical diagnosis and decision making?
So we have like some study resources that we use that like preparing for boards and things like that. So we have different like question banks and stuff online. But then so that's kind of where we get like our foundational knowledge. And then when we're actually like in clinic, a lot of times we use like open evidence and like I have Amboss, so I'll use that sometimes. That's like kind of like a Google, but for med students, that's what we kind of call it. Um, and yeah, otherwise, yeah, that's kind of like the two main ones. We use open evidence like pretty much all the time. That's probably like our number one thing that we use.
That makes sense. Thank you for that background. You said it was open evidence, and the other one was it AMBOT?
Yeah, it's like it's spelled Amboss.
Oh, I see. Ah,
Yeah, but that one's not free. That one's kind of expensive. So
expensive. That makes
yeah.
sense. And open evidence is free.
Yeah, it's free for med students anyway. They have like a program for us. And then there's also like I think so a lot of people use Up to Date. I don't really use it just because I haven't figured out how to use it so much. And then there's like a couple other apps where they give med students access for free.
Oh, wow.
So we sometimes use those. We don't have that much time though to go to all the different um like apps. So I kind of just go with open evidence because it's easy and I can type questions like really stupid questions and it will still kind of figure out what I'm talking about. So
That makes complete sense. I'm the same way. I go with what's easy and free. So,
yeah.
well, I really appreciate all the sort of background information there. I think at this time we can dive into some of the real fun stuff today, the tasks. So at this time, I'm sending over a link to the prototype we'll be using today. I'll send it to your phone number now. So you
Okay. Yeah.
should get it in a minute. I'll let you know that it has limited functionality. Basically, it's sufficient for the task we'll complete in this session, but some parts of the app may not be clickable or fully built out, just so you know.
Okay.
And whenever you are able to open that prototype, if you can share your screen, I'll make sure everything looks like it needs to be today before we get started.
Okay. I got it.
Perfect.
I am just really bad at sharing my screen and
Oh, no worries.
1 second. Okay, yeah, this isn't so bad. Okay. Um, no, I don't want to do that. Sorry, just a second.
Oh, no worries.
Um, oh, if I just push this. Okay. I don't know if this is gonna work or not, but let me see what happens.
That's perfect. Yeah.
Does
And then you
it work?
should
Okay.
be able to um
Go
nav yeah,
in.
just like that.
Okay. Can you
Perfect. And then
then?
I can see it. And actually, as much as I like seeing myself on the screen here,
Oh
if
yeah,
you
yeah.
I think if you push you can if you navigate to the prototype and
hmm
then um that little window, if you push it all the way to the left, I think that it should put me out of view and then only
Oh
the
yes. There.
there we
Okay.
go, perfect. So you can probably hear me, but not you
Yes. Yeah,
the
that's
don't have to see me anymore. It won't obstruct the prototype.
Gotcha. Yes.
Perfect. Everything looks good. So I think at this time we can kind of dive into things. As a reminder, if you're able to think aloud, basically articulate your thoughts as you go along, that's a huge help. Um,
Okay.
with that being said, are you ready for our first scenario today?
Sure. Yes.
Perfect. Before we begin with specific tasks, I'd like you to take a minute to explore the app on your own. Please look around as you normally would when opening a new app and tell me what you think this app is for, what you notice, and what you would expect to be able to do here.
Okay. Um, so if I just opened it, I would look at, well, my first thought would be like, okay, so I can practice like questions or read articles for each of the different specialties. Essentially, that's kind of what I would think. And then um I would be confused a little bit like where it says start practicing if I would like click on one of these and then click start practicing, or if I click on one of these and it would just start working right away. But then I would just click on it, I guess. So can I just click on stuff or do you want me to
Yes, yes, please
just
feel
click
free.
on? Okay, whatever I like the best. Maybe I don't know. Let's see. Internal medicine. I guess you can't really go wrong with internal medicine. Okay. Oh, okay, okay. So I yeah, and I've done like a kind of some things like this before, so then that makes more sense. Okay. So abdominal pain, diarrhea, mild fever. Okay. Okay, so okay, that's cool. So it tells me like how much things are costing and how long it's taking up in the corner, like on the left. Um, I think is this what I okay, so this is kind of what I read, but maybe I can go back to that and look at it again if I forget. Um, and I would assume diagnosis for after I do all the other things because I didn't really know what to do right away. But okay, so examine. Okay. And then I can click on, all right, so I can kind of click on these different things. So physical. Okay. So then, oh, so I can kind of pick like which things I think would be important. And then, oh, whoops. Oh no.
What
Okay.
happened there? I heard you
Oh, so
oh,
I think I clicked on something on accident.
uh
And then I just went back, but that was okay. Just I think I clicked on something on accident.
nice.
Um, okay, so I don't know what cytogenetics means. Maybe I click on that. Oh, okay. So like neurology stuff. Okay.
And I hate to cut you off, but for I really appreciate all the insights and all the thinking aloud you're doing, just for the sake of making sure uh, we don't keep you here longer than is absolutely necessary. I just have a couple follow-up questions about that.
Yeah,
Uh,
okay.
what would you say, or could you tell me about your first impression of the app?
Um, Kind of excited to check it out.
Oh,
I
that's
think
great.
that would be it's cool and it's like all those resources I was saying, those are all like I come there with like wanting to know a specific question. This is kind of nice because it's sort of what I would be doing in a clinic, but I can see it all laid out in front of me and it gives me a better idea of like what I could choose to do if I were to like if I had everything in front of me rather than being in the room and having to think of it on my own, if that makes sense. And
Absolutely.
then like if it really like I don't know yet because I didn't click on enough things, but if it actually tells you how much stuff costs, I've never had something that does that before. So that would be actually super cool.
I'm going to take a quick note of that. That's a really interesting point. Thank you for all the insights.
Mhm.
And just as a sort of follow-up to that, as you looked around, what stood out to you most, good, bad, or otherwise?
It's simple. Like the first page is simple, and I'm really bad. Well, you saw me trying to share my screen. I'm like, I'm really bad with technology. So, yeah, like having it be simple and then get more complicated as I start to learn things, because otherwise I'm kind of like, I don't know, like a grandma, and I get a little overwhelmed if there's too much on the first page. I'm like, no, I don't like this resource. So, yeah, I think that's what kind of stood out to me as good. Um, Not necessarily anything bad, really. Like, not just to be like nice or anything, but like there wasn't anything that made it too complicated or too confusing or that I didn't like how it looked.
Really appreciate all those insights, and I'm sort of the same way with technology, so I can definitely empathize. Thank you for all the again, thank you for all the thinking aloud you're doing and everything. It makes my life a lot easier.
Yeah.
With that being said, I think we're ready for our next scenario. It may
Okay.
be simplest if we start back at the home page, um,
Okay.
which we may have to let's
Like push the button, like the back button, like in the bottom left.
yeah, I think that should get
Back.
us.
Okay. Okay.
Yeah. And then
Yes.
I
And then
think
this
it's
button.
one
Oh no. Whoops.
more.
Okay. Wait. There we go.
Ah, there we
Okay.
go. Perfect. Thank
It's like
you.
we'll get there at some point. Okay.
Our next scenario. You are
Okay. So
using, oh, sorry, go ahead.
oh, I wasn't sure if I was just picking something, but I'll listen.
Yeah, no worries. I'll read this scenario and then um, we'll kind of go from there.
Okay.
You are using the mobile app learning tool in front of you to practice clinical decision making. You are presented with a patient. a child named Elizabeth Doe. Using the app, show me how you would begin evaluating this patient and decide what to do first. Also note, as you go through the process, keep in mind that both time and cost are important factors when making clinical decisions.
Okay. Um, so if I just heard that, I probably would pick like peds, like go into the peds section just because it's a kid and everything. And I'm not sure like what their complaints are yet. So I just kind of click in here, I guess.
That makes a lot of sense. I completely understand that logic. What happens if we press start practicing first?
Oh,
Curious.
yes, let's do that. Okay. So, okay. So now I'm just like going through what I would do if I had this patient.
Exactly. And
Okay.
just as a reminder, there's really no wrong answers here.
Okay. Yeah, so like I usually would start with like chief complaints so I have an idea because sometimes it's like easier to start there and see like what they said. So, okay, so abdominal pain, so I have the onset and the diarrhea. I also have the onset and then fever started an hour ago. Okay. Awesome. So, kind of like what I would normally do in clinic is sort of, well, normally I have to ask all of these things, but then I would sort of take that, start thinking about what I think it is, um, and then go into examine, and then usually, okay, so like for this, I wouldn't think imaging is that important. Others, I'm not sure what that means right now, but physical and laboratory, that's what I usually focus on when I do stuff. So I'd actually probably look at laboratory first because she sounds kind of like she's sick. Um, and then I'd go like, let's see, which of these would I want the most? Probably immunology. Yeah, I think I just can't. This button doesn't want to click, or can I click on these buttons? Or
That's a
am I?
good that's a good question. Some of the functionality of the tool is built out, other areas aren't built out. So
Oh, okay.
you you can try and click on it. Sometimes it will lead somewhere, sometimes it won't.
Okay. Okay. So I would click on like immunology, probably just look at like white cell counts, whatever. Um, and then I'd probably just start with just that for lab values, honestly, if I am like trying to not spend too much money, I guess, too. So, yeah, I really would just look at the white cell counts to see if it seems like she actually has like some sort of infection. And then that way I can sort of narrow down what I want to do next. Then I'd probably go back. I would probably do for physical, I would do like, let's see, probably an abdominal physical. And then I probably would do a skin physical to see if there's any like rashes or something that we're missing because kids always have rashes and that can kind of tell us what kind of infection they might have.
And do
And
any of
then,
those do anything if you
oh,
try?
I don't know. Okay, let's see. Oh yeah, perfect. Okay. Okay, yeah. So then I would think, so okay. So yeah, that McBurney's sign. So I'd be kind of worried about maybe an appendicitis or something. And again, if I looked at like the white cell count too, then that would give me a good indication. So those two would be good things. And then otherwise, I probably still would do a skin also to see if there's anything. Let's see. Okay, this one doesn't have, but I probably would do that. But that's probably something not everybody would necessarily do. I think everyone would probably do an abdominal physical though. But okay, and then and then general appearance and vital signs. I kind of skipped over that. Yeah, I would definitely do that. Okay. And and vitals. Okay. But yeah, those are the two things that we kind of always have to get those. And like our attendings always ask us for those too. So, and that's good because so if she was like, if it wasn't appendicitis, we'd kind of need to know those if we could like take them to like surgery anyway. It's kind of like, or like how fast we need to. Um, Otherwise, okay, the rest of these, so like, yeah, respiratory, probably not. Cardiovascular, usually we do that. We usually would do like heart and lungs no matter what, but would depend on like, I think probably would start with like abdominal and see like how emergency that seems. And then maybe would skip some of these other things too if it was like appendicitis. Um, But the rest of these musculoskeletal, maybe if we were thinking like meningitis or something, but like given her symptoms, it wouldn't be like as likely that it's meningitis. But if I went back, I probably would. Okay, well, I'd look in the others, I guess, too, and see what that is. Oh, okay. So biopsy, ECG. Well, this is kind of related to what we're talking about. So I guess I would click gastroenterology and see what that would be. Okay. That one doesn't load, but um yeah, I would see kind of what that one means. I don't know if any okay. Yeah, because like biopsy, ECG is not really wouldn't really need for this one. Neurology, like if we were thinking meningitis, that'd probably be something I would click on too. And then pulmonology would be like, I mean, most kids usually you do have to do that sort of thing, but she seems like she's having more of like a GI issue than a respiratory issue. And then I just click on imaging because I'm curious what. Okay, so ultrasound, X-ray, CT, MRI. Okay, so we would. I mean, as long as she's not like. I mean, if we had her vitals, I guess, and how crazy her vitals look, but usually like would do an ultrasound or a CT if we were really thinking appendicitis based on like clinical features, then we probably would just go right to CT, I guess. Okay. Okay, so that's cool because we never ever talk about like how much those cost. So that's kind of good to know how much that would be. So yeah, like abdominal CT. Okay. Okay, cool. And then it says how long too, because that's the other thing that like never really know. I mean, a little bit. I guess I found that out just like a couple of weeks ago when I was on one of my like rotation things in the hospital and we took someone to CT. I thought it took like 3 hours and I was like, oh, that was really fast. So it is kind of nice, especially like as a student, to be able to see this stuff because usually don't get a chance to ask attendings because when we are like going for a CT or something, it's an emergency and they're not really in the mood to like be teaching us about how much healthcare costs at that time. And also like what was I gonna say? Yeah, and otherwise like we're in clinics and when you're in clinic, they don't really I mean, we don't do a whole lot of that stuff. Like we sort of can find out like lab tests and how expensive those are and then like a little bit about like x-ray and things, but a lot of the stuff that you would normally do in the hospital, like as students, at least at our school, we don't always get exposure to that.
That makes sense. I really appreciate all your, once again, kind of thinking out loud. I hate to cut you off. I just want to
Mhm.
be mindful. I don't want to take up any more of your time than is necessary. I would like to ask, on a scale of 1 to 7, with 1 being very difficult and 7 being very easy, overall, how difficult or easy did you find this task to be?
Um, Probably like feels like okay, 7 is like super easy.
Hmm.
So probably somewhere like a 5 or 6. Like
7.
it was relatively easy. And then I think it's just because like the things I was clicking on I couldn't get and some of the things I would have but and that's not really anyone's fault. And then just because there's a lot of things to choose from. So like I wanted to make sure and especially like with the like time and money aspect to make sure I'm only kind of thinking about the things that I would really want to use. But that's a little bit on my end too of like don't want to click on every single thing, even though everything is available right there. So
Right.
yeah, so probably like a 5 or 6.
And would you say that the information about time or cost would affect your choice when deciding which examinations to choose?
Oh yeah, yeah, definitely.
That makes sense. I really appreciate that.
Hmm.
I think we're ready to move on to our final scenario within the app.
Okay,
Uh,
so go. Should I go back?
wherever is fine, I think. Just
Okay.
sort of, yeah, whatever works best. But
Okay.
based on the information you've gathered so far, use the app to select what you believe is the most appropriate diagnosis for a listener.
Oh, okay. Um. Okay. Cool. So infectious blood diseases, endocrine, nervous system, respiratory, digestive. Okay. Hmm. Yeah, this is pretty much like how we kind of set our stuff up too, like musculoskeletal. Yeah. I just need to think. Let's see. So fever and diarrhea and abdominal pain and hmm. I guess that probably something like digestive system or yeah, probably either an infection of some kind or maybe an appendicitis would be the two that I would think between. Let me see. So if I were to pick like, all right, so infectious diseases, just see like what's in there, I guess. Okay, or I'll pick what's in. Okay, here we go. So esophagus, stomach. Okay, if I did, okay. Okay, so appendicitis with either localized or generalized. So then that can kind of tell you, I guess, how like the severity or like how long or how much time you have before um, it becomes a serious emergency. The amount of like peritonitis, otherwise unspecified acute appendicitis or other acute appendicitis. Okay. I'm not as sure what the other two would be, but based on like the exam finding and stuff, I would probably click on like generalized peritonitis. Oh, so okay, so that night, okay. So can I
And
go?
what comes to mind when you see the information presented on this page here?
Oh, it makes me feel good. um, but like, let me see. So my diagnosis, correct diagnosis, the amount spent, ideal spent. So would my spending though be? I mean, it's just because I didn't really click on any tests fully, right? So that's why it's coming up as like 0. But
Yeah,
I like if I really clicked on it, I could like kind of compare um how much it took me to get to the right answer versus like in a perfect world what it would take. Is that kind of the thought?
exactly. And I'd like to get your thoughts. What do you think about that?
Yeah, that's really nice to know. Really, really nice. Yeah. Like I mean, I know I kind of already said this, but like we really don't get to work on those kind of skills. And I mean, I'm already in my 3rd year and I mean, I know we can learn a lot in a year, but we only have one more year left. So I'm not sure like when we start to get a better idea of that stuff or if we do even. So having like somewhere that you could go to see that and see how much you could spend if it were like I said, like in a perfect world, how cheap you could make it. Because that's everyone's concern. And that's like as like providers, we're really concerned about that because we don't want people to feel like they don't want to come in and because that they're worried like how much it will cost them, and then their issues become bigger issues or way more severe, and then it will cost a lot more. So like if whatever we can do to like streamline it to make patients more comfortable with coming in. So really it's just like it turns into like a huge thing even though it seems so simple, like oh you just need to know how much things cost and what to order, but yeah, it all comes back to like bigger issues and actually helping people like in a bigger way than you expect to, I guess.
Yeah, I really appreciate that perspective. I'm really thankful for that insight. It's something like from my position, it's hard to kind of envision that, but I now realize just how important that sort of is from the clinical perspective.
Yeah.
I really appreciate again all the insights you've provided and all the thinking aloud. I would like to ask, like our previous task, on a scale of 1 to 7, with 1 being very difficult and 7 being very easy. Overall, how difficult or easy did you find this task to be?
I think that this was definitely a little bit easier because I had an idea what I was looking for. So then like going through the different systems and trying to like figure out where what I'm looking for would fit. Um so yeah, I'd say that this is like a 6 because definitely like basically like super straightforward. And then also if I were more sure of myself, I could have just typed it in. I saw the box at the top too, and then I could have just found exactly what I was looking for. But I kind of wanted to see like I kind of wanted to look through it anyway to see what other diagnoses were like in the same area to see just to like reinforce my thinking of like am I missing something that's similar, and I just missed like some of the obvious cues for it, I guess. But if you were like people were more if you had a more confident med student here, they probably would have thought that that was super easy to do.
You strike me as very confident. So
Oh well,
I,
thank you.
yeah, I know we're right up at time, and I know as a medical student, your time is incredibly tight and valuable. I do just have one quick follow-up, or I guess a couple quick follow-ups.
Yeah, no problem.
What are your thoughts about? We looked at the app kind of individually in different scenarios, but thinking in terms of it as big picture, what are your thoughts about the app overall, good, bad, or otherwise?
Oh, I think it's good. I think so we've done like we did one of these with, I don't know if you've ever heard of Sketchy,
Mm-mm.
but that's a thing that we use in our first, like a lot of people use it in their first year. They do a lot with like bacteria, like learning microbiology type stuff. And they were like starting a program where it's kind of similar, but it was more of like an AI thing where they would like give us some stuff and then we had to type back to them. And it's like I understand that this could be helpful,
Yeah.
um but it just got really frustrating and kind of annoying, and especially like in our we were still like between our first and second year and we really didn't know that much yet. So trying to do like an AI type thing was really difficult because we didn't even know what to ask or what to respond. So it wasn't, I mean, it was really like it actually like was really annoying. I was like, I really don't want to sit here for 45 minutes trying to figure out things that I don't even know. But using something like this, even if you were a younger student and you didn't know as many like exactly where you wanted to go with each situation, you could like go through it and at least look at it, and then even if you're getting it really wrong and you're spending a lot of money and a lot of time, then at least you know which things you're clicking on and you're still figuring out like how much time would it take to do this or how much would it cost to do this, and then you can sort of think like, okay, so in the future, like what did I learn from this test and what I learned from getting that test, and which one could I have ordered for the specific, like for what I wanted to find. Like I could have maybe cut this down to just one test. And okay, and sorry, I'm kind of like rambling, but
No,
it
no, please, I
also
love the
would be
insight.
like it also would kind of like let you know exactly what each test could tell you, because that's the other thing, like when we go into clinic, they go, okay, we'll go in with the patient and figure this stuff out. And you're like, okay, well, so you go in and you're like listening to heart and lungs. And I'm like, I'm not very good at picking out murmurs. Like, I don't even know. And when I'm listening to lungs, I'm like, okay, yeah, I think I heard like some crackles. I don't even really know exactly like what that means or how that's helpful. So to see it here and get a little like, okay, so when you listen to the lungs, this is what the findings were. And then if you don't know what that is, like if you were just using this at home, like for practice, like you don't know what those findings mean, then you could do a little bit more research or like at least you see it and you're like, okay, so then when I'm doing my practice questions, um if I hear that in a question, I'll be like, oh, okay, so that's what that means now. So I think it's helpful for that from that aspect too, if that makes any sense.
That makes complete sense. That makes complete sense. And I know we're just a hair over time, but I really, really want to thank you for your time here today. This
Oh
has
yeah.
been fantastic. I've learned a lot. I've taken like a whole page of notes. I've got a
Oh,
lot to go over. I really appreciate it. Thank you again.
yeah, no problem. This was really cool. Thank you for letting me try it out.
Absolutely, absolutely. Thank you. And I hope you have a great rest of your day.
Thank you. You too.
Thank you.